Hi, everyone. Doug here. Super excited about today. Appreciate everyone coming on. This is actually going to be a webinar that we go over a little bit today. We're going to go over some really cool things about the medicine cabinet, but this is actually going to be one of the main focuses at the super seminar this year. And we're going to do a really deep dive into this subject at the super seminar, and I'm really excited about it, and we'll talk more about that. But this is a subject that, I think that in looking at it is one that I wish that we would have actually hit sooner. We're working to actually create some literature for you, some things so that you'll be able to easily help with the patients of, hey, patients, what do you have in your medicine cabinet? Oh, you know what? There's a better choice. There's a healthier choice. There's a holistic choice. And you'll be able to explain some of the side effects of what they're taking so they can really measure, and balance the risk and hopefully make most of the time some choices from just the natural standpoint. So super excited about it. As normal, what I'd love for you to do as you come on, please list your name and where you're from in the chat, if you wouldn't mind. Just go to the chat, and we'll want to make sure it's working, and put who you are and where you're from. And that would be really great so that we can see that. Oh, appreciate Daryl, always first one to jump on there. Appreciate that from Charlotte. Hey, Becky, good to have you right here in the office, 3 feet away. Appreciate that. And as everyone else is typing in there, hey, Linda, awesome. Texas. Daryl, I was close to you somewhat, just about 10 hours ago. I was in Virginia Beach, Virginia. And so we got back not too long ago, and but it was beautiful back there. So love that. Be jumping back on another plane, heading back out east tomorrow. So, hey, Ruth, welcome. And Top of the Rock, glad you're with us. And Dimitri, hey, good to see you again. Dimitri is out at our product training, Howard Beach, New York. Good to see you, Deborah. Glad you're with us. Thanks for being here. And John Trainer, howdy. And so Dr. Janine's with us. Good. Dr. Janine, you pitch in anytime here. Help with this if you like, please. And we didn't have time to talk much because I just got back. But Laura Lee, thanks for being here. And so thank you all so much for being on. And we'll go ahead and get started. And I know the rest of the docs are coming in from the waiting room. So thanks for being with us. Thanks for being on early. And we're going to jump right into it. And the goal today is to get to some questions and answers before we switch over to the public. So the format, remember, for the next 26 minutes, we're going to be going through some of the highlights about the webinar. We're not going to go into great detail because we're going to share that with the patients as far as some of the research and exactly, why different products should replace others and prescriptions. But with this, we're going to talk more along at pricing. We're going to talk about what's coming up, make sure that you all get your questions answered, and then we're going to flip it over. And one thing I wanted to let your health professionals know is that the purpose of doing this format every month is for you to promote to your patient base so that we can educate for you. So you come on, but educate to your patient base, forward the emails, ask the office for the emails to be able to send to your patient base to come to this webinar once a month where they get educated and they learn and they want to use more of the formulas and ask more questions to you. And it's really a great way for you to build a business, because I noticed that the doctors that send the patients to the webinar, so the retail webinar that's right after this one, the preferred patient webinar, that those are the ones that really blow up their business because we're helping sell for them. All of a sudden, their commission check goes up dramatically, and all they're doing is promoting their patients to come listen to this cool webinar to get the latest research and information and those types of things. So let's jump into it. And we're going to be talking a lot about this again with your patients. But is your medicine cabinet helping you or hurting you? Because most people have a medicine cabinet to help them. That's the whole purpose, right? And if you take a look at it, especially from the long term, it's not. And the main purpose is to, one, get us out of pain, right? We have some pains, we go to the medicine cabinet for it, whether it's a topical pain, internal pain, whatever it might be. and then also to stop additional pain or inflammation, infection from happening. So we have this pain we want to get rid of. Also, sometimes that pain might be a cut or a bruise or something, and we don't want additional pain or inflammation or infection from that. So that's our main purposes of the medicine cabinet. So the problem, though, with the normal medicine cabinet and the drugs is the harmful side effects. A study that was published in the JAMA warns that depression is a potential side effect of more than 200 commonly prescribed and over-the-counter medications. What does that mean? That means that the things that people are doing to get rid of acid reflux, to get rid of basic pain, to help with allergies, and all of these things that they go to their medicine cabinet for is actually causing many side effects that most of you know about. But one of them that you might not know about is depression, that just taking these prescription drugs is completely depleting a lot of the nutrients that keep your body from having anxiety, from having depression. And so we're actually causing this huge problem that people then go to more and more drugs. And 69% of the drugs have between 10 and 100 different side effects. Now, this is from the CDC. 69% of drugs have between 10 and 100 different side effects. 22% of drugs have more than 100 possible side effects. Why would you get a side effect versus not? You already have a nutrient deficiency. That side effect is going to come on strong. Just going to deplete the nutrients, and then it's going to come on strong. You have a genetic SNP, right? A single nucleotide polymorphism. You have the SNP genetic factor. That's why some drugs work different with different people. And so over 100 side effects, basically you're guaranteed to have some side effect. High majority is going to have between 10 and 100. And a fourth of you and your patients are going to have over 100 side effects. That's serious. That's enough reason in itself to get rid of the normal medicine cabinet drugs. So with your patients, we're going to talk about the drugs. We're going to talk about anti-inflammatories, non-steroidal anti-inflammatories, prescription drugs. We're going to talk to them about over-the-counter drugs, ibuprofens, right? Aspirin, Tylenol, and the side effects of these drugs. So we'll go into detail with them, and what they should replace that with is a natural NSAID pack. So that's one of the focus products for the month. And we're going to go through and talk about the absolute necessity with your patients to have the natural NSAID pack in your medicine cabinet. It is an absolute staple in our home. Anyone we talk to, any family members, it's there. One of the first things you go to when you have pain, inflammation. And the majority of the time, that's all you need. Okay. And so it's really one of the key factors and products that we're going to focus on in the webinar with them a little bit later, and go through the details of it. Okay. And about how the research shows that it helps reduce inflammation, repair tissue, promotes cartilage health, and how it also helps make a more healthy and safe environment and lowers overall inflammation in the body. And we'll go through the ingredients of that. As most of you know, the main factors are the proteolytic enzymes. The research we did at the University of Toronto, Dr. Trethart and Dr. Fisher, of being able to reduce inflammation better than NSAIDs and actually help heal the body 3 times faster. That specific blend from the research study is in the natural NSAID pack. It's also in acute if you want to go just a bottle. But the natural NSAID pack has not only the acute formula, and it says protease anti-inflammatory. When you get your custom packs, that's the acute formula. It also has the chronic, the joint nutrients, it has the essential fatty acid, and the latest breakthrough, which is the phytonutrient anti-inflammatories that Dr. Harris turned us on to with Protect. So the phytonutrients on the custom pack label says phytonutrients, it's actually Protect. That's why people know what it is. And then we're going to talk about the importance of sleep. We're going to talk about the detrimental effects of sleep prescriptions, medications, even over the counter like NyQuil. And we're going to talk about the importance of being able to have a good night's sleep. And that our answer to that is a low dose melatonin, a Passiflora incarnata extract. And then we use that in the sleep gummies. Now, this thing is absolutely a game changer. This is one of my everyday products. I only take half a gummy. My wife takes a gummy and a half. So we go through 2 a day, right? She bites one off and I take half. It takes very little for me, but I need it. I'm on the road a lot. I think I'm on the road now more than I've been since probably late 20s, early 30s, and I'm a little bit older than that now. And I've been to the East Coast 3 times in the last 4 weeks. and that's a 3-hour time difference. And like I said, we got back this morning, 4:30, 5 o'clock, and then came into the office a little bit late, but made it to the office. And but why am I telling you that? Because this has been a saving grace for me. And it's a really for a lot of people, because it takes very little. You're just giving the body this, it's almost like like what peptides do, is it actually just stimulates the body like a secretagogue for the body to make more of the natural melatonin, fill in those receptors, right? Kick out the caffeine and help the body with those receptors in the brain with adenosine to be able to help sleep. This product is a game changer, and your patients really should and could get off almost every type of prescription while taking this, especially the over-the-counter ones. That's a great product. Then we're going to go into synthetic vitamins. I just spoke the other day, yesterday, with Magic Johnson, Tony DiSilvestro, David Meltzer in Virginia Beach. And I said, you know what? It was hundreds of like entrepreneurs. And I'm like, screw this, I'm going to pull out all the stops. And so I went hard on them about what's going on with the tobacco companies buying up the food companies and the pharmaceutical companies buying up the vitamin companies, and how they're being deceived. And we need to eat whole foods. We need to get back to nature. We need to take whole food vitamins. And I was wondering how it was going to come across, and it came across phenomenally well. We had a breakout right after the main stage talk, and every single one in the audience came to the breakout. They had to basically turn off the other breakouts and open the room more, because people want to know the truth, and they know in their gut something's wrong. And one of the things that's wrong is synthetic vitamins. It's killing us. We'll show some of the research in the webinar here in a few minutes when we go to the public. And, you know, we need to make sure that we are taking our whole food vitamin mineral, like the capsules, or if you like the gummies, that's fine too. But your kids are taking something that they will chew and take, that they're getting whole foods on a daily basis. So this isn't just for kids, but it is one of the ways that children can be able to take their whole food vitamins. And the reason we didn't come out with a whole food or a gummy for years is because we couldn't make it whole food without synthetics until just recently. So super excited to be able to have that product. And we're going to explain to get rid of the synthetic vitamins in the medicine cabinet to use the whole foods. So hi, Holly from Maryland. Thanks for joining us. And then we're going to be talking about antibiotics with your patients and the public that's on the webinar here in a few minutes. And we're going to be talking about the heat stabilized probiotics to be able to counter the effects of antibiotics, and many times replace even having to have antibiotics. We're going to go through what it means, right? Anti against biotic life, that's against life. Antibiotics destroy all life, even the good bacteria. And we're supposed to be have up to 3 pounds of friendly bacteria in our gut of all times. 50% of our body is made up of bacteria, so we want it healthy, and that we're destroying it with antibiotics. And so we'll be talking about those, and also eating of meat and things, not to get people completely off of meat necessarily, but to have them understand that most of the meats that we're consuming today have antibiotics in them. And so you need the probiotics. And so we'll talk about replacing, or at least going to the probiotics first before you ever look at doing the antibiotics. And I'll give you some of that research. We'll go into Dr. Shahani's work, one of my mentors, and the importance of replacing antibiotics with probiotics. And I think it'll be a big eye-opener for a lot of your patients. So I hope you've seen the importance of having your patients join us once a month on these seminars and promoting to them, because as you'll see as you stay on for the public webinar in a little bit, that it's a huge advantage for you, because we do a lot of the work for you in the educating. So the specials for you all, just for the health professionals, right? It's 15% off wholesale, no matter how much you order, until the end of tomorrow. Is it tomorrow night? 28th. So you get, tomorrow night. It's end of, right?
End of the month.
End of the month. And so you get that special. And on top of that, if you take advantage of the natural NSAID packs, then you actually get some additional product like the sleep gummy for free. So I know a lot of you stock up the natural NSAID pack. I do. That's a big thing to stock up on, because you want your patients to have these in their medicine cabinet. It's not like your patient comes in and they say they're hurt or they have inflammation, and in pain, and you get a natural NSAID pack off your shelf, doctors, you need your patients to stock up on the natural NSAID pack to replace the NSAIDs in their medicine cabinet. So this is something you should be selling to every patient, not just that, okay, my patient has in pain now, I'm going to get them the pack. They need to have it ready. They need to have it ready. Can we unmute Janine by chance? Okay, so Janine, Becky's going to unmute. I'd love for you to share a few things on that. And thanks for putting that in the comments. So again, if you stock up on the NSAID pack, so not only do you get the discount, but you'll get additional free product like the sleep gummies, and you can order online also. So those are the main things that we're going to be going over with your patients, again, in great detail, going over the research with them. And so really, really excited about that, what we're trying to be able to get Janine on. Let me tell you about the super seminar coming up, guys. This thing's getting more and more exciting every second, like ridiculous. So let me tell you about some of the things. I really hope you come to Tucson. One, it's Tucson, Arizona. We're up against the mountains in the back there. We're going to have all kinds of really cool stuff from some Indian tribes type stuff, doing some things. We're going to have this one isn't me, but they're going to have like teach you how to dance, country dance type thing on the first night, an outside little area in I'd say a barbecue, but an outside meal. And it's just going to be fun. But besides the fun and the beautiful, we're doing some hikes too, by the way, some hikes up the mountain there. That's just easy to do, but beautiful wildlife that's there. And you're going to just love it. But anyways, the thing is that at the super seminar, besides Dr. Brimhall giving some phenomenal information, Dr. Harris, I'm going to be doing some talks and some new research. Here's some cool things that no one knows about yet that I want to share with you. 2 new products. One of them has to do with hormone balance with estrogen. Game changer, by the way. It'll change the industry. Others, another new product from Dr. Harris. We're talking the berberines. We're talking the high alpha lipoic acid type stuff. Crazy cool. And then we're working hard on introducing 2 new technologies there for you. One of them that I'm going to actually invite, she doesn't know it yet, but Dr. Ridgway to maybe share with you guys at the seminar on ability to check for blood vessel flexibility, to be able to do ERV in a different way, and really simple with your patients. Super good. Okay. So you're going to be phenomenal. And then we have a guy named Joel Evans come to speak that is going to really blow the roof off of some of the things, the corruption that happened during COVID. And you don't want to miss that. It's going to be phenomenal. So already we have some crazy, phenomenal speakers coming. We haven't even announced them all yet. We have new products, we have new technologies, and they're all being launched in Tucson. And you're going to be getting some of them for free as far as new products and stuff just by attending. Guys, I can't emphasize enough that this is the super seminar to come to because it's so much new stuff. Where it's at is just mind-blowing. You're going to love this resort in Tucson, Arizona. And you can fly into Tucson, you're going to fly into Phoenix. It's like an hour and 15 minutes from Phoenix, or you can fly into Tucson. It's right there. So super seminar, please sign up your friends, bring your staff. It's going to be phenomenal. I'm just really excited. The Scope seminar, as of right now, it's sold out because we're doing it here at our facility here in Arizona. And we wanted to limit it to 20 clinics. We're at that right now. We're seeing what we can do to maybe get a few more in. So if you absolutely positively want to come to the Scope Blood Seminar, let us know. And we're going to see what we can do to maybe open up a few slots for that. But it's pretty much sold out. You snooze, you lose. Okay. We're going to be talking about the prescriptions and that here in just a minute. And I think that it's one of those things that is a new podcast that we've done, me and my wife Hillary, called Fit Fam. And on that podcast, it's really great for you to send your patients, because we'll be talking about making sure you get with your holistic doctors. And we're talking about different subjects that it really is practical application. One of them was prescription drugs, the latest one out. And we have another one coming out tomorrow, I believe, launching. And so please follow some FitFam. I'd recommend do it on YouTube. Go to YouTube, FitFam. Make sure you click the what's it called, register, or the little button on there to make sure that you, what is it? Subscribe button. Please do the subscribe button so that you can be informed of when some new podcasts come out. We're launching one every week. Super excited about that. Scan that code right there, FitFam Podcast. And this is great for your patients, great for you. It's really a different approach because it's an approach more for the public to listen to, but it's very research-based and we have fun with it. Hillary keeps it real. And so really appreciate you guys. All right, Janine, are you on there? Can you hear us?
I can hear you. Can you hear me?
There you are. There you are.
Hey, how you doing?
Awesome. So glad you're here. Real quick, why don't you comment a little bit on the NSAID pack? I know you made a note there, and then maybe just anything on what I've mentioned so far, and we'll open up for questions and answers a little bit for the doctors.
Well, everything you just mentioned is super exciting. I love Super Seminar. It is my favorite seminar. It sounds like this is going to be the best one yet. And I'm very, very happy to help launch that new product that you're talking about. That's going to be phenomenal. The NSAID pack is an absolute game changer. I have had such phenomenal results with it. I actually have done this natural medicine cabinet topic a couple times on Thriving Thursday, and everybody loves it. Everybody takes action. So it is, if you get this thing shared, I just went and shared it on my page. Just make sure everybody sees it right at the time so they don't forget. And if they get on there, I mean, you will really get some new preferred patients from this. But I tell people, when you need it, you need it. Things like the NSAID pack, like the exposure pack, you just got to have them, you know? So I think this is going to be an amazing webinar. Excited about it. What else? FitFam is phenomenal. It has been unleashed. I don't know who this person is, but it is amazing. It's a very, very good perspective. Just getting to see the dynamic and everything that's shared. I think that that's another way to really help to educate our patients, to share that with them.
I agree. And I think it's nice because we haven't got Hillary to share like she does in FitFam. She feels more comfortable there. And so it works well because she has just a plethora of knowledge that I think that your patients would benefit from. Appreciate Ruth Ross in the chat. She said, I sample the patients and tell them the next time. She gives a sample of like the NSAID pack to the patients and tells them the next time they want to take a pain reliever, take the sample of the NSAID pack, and then they notice how beneficial it is, and she does a direct script for it for them to order.
That's so good.
Really, that is a great tip for one of the pros out there for you health professionals to be able to use. And so if you have any questions, put it into the chat right now. We have a few minutes.
When we launched, I just want to say, when we launched the NSAID pack, that was one where people were sending me all kinds of DMs and texts and messages saying, oh my God, this thing is amazing. I mean, they can really, really feel the difference with that one.
Absolutely. I think that, you know, in speaking yesterday in Virginia, that was a big factor because we were talking about getting people off of the synthetics that the world's trying to tell you is good. And I was sticking with foods, right? The Twinkies and things like that. And someone brought up, yeah, but I like the drugs to get rid of pain. It just numbs my mind. And I don't feel normal when I'm on them, but I don't want to be in pain. And the natural NSAID pack really is it. And one of the things we're going to bring up, docs, here in this podcast or in this webinar in a minute, is how drugs cloud the cells. And so it makes it so that maybe you can function, but you can't function at the highest level, your highest frequency. You can't be present at the highest level. And I think that people lose that. They lose that fact that these drugs are basically turning them into zombies, basically, and that they should really take a look at it.
Mm-hmm.
And
yeah,
so,
and I just feel like more and more people are really looking for what we have. I'll share something thinking that it's nothing. I'll just jump on and share a little something. And so many people just thank me and really appreciate it. So just know every little thing that you share, every little tip you give people, they're looking for it. They want it.
absolutely. It's a really good point. And I think that as far as the new technologies that we're coming out with too, it's really good to understand that the ability that you, or the ability that you have to help your patients in the moment is critical. And we're really focusing in on some more of those technologies, meaning inpatient, that your patient is there and they can do a little test or do something that immediately gets results. And it creates this ability for you to have this drive for your patients to come see you. But at the same time, you have the ability for those that can't come see you or after they leave your clinic to take care of them with technology also. Not just having the tools in the clinic, but having the tools outside the clinic. That's where Direct Script comes in that Ruth just mentioned, or the Nutrients RX, where they do the blood work and they can do it from anywhere in the world and that type of a thing. You need to have both technologies. You need to have the technology in the clinic to immediately help the patient. Oh, cool, you got to go see Dr. So-and-so or my health professional because you're going to do these tests that are really cool to do, and they'll evaluate you. And we have 2 new ones that we're going to be launching at Super Seminar, but also then the technology outside the seminar, outside of your clinic. So make sure you evaluate that. Do I have the technology that draws people in to my clinic right now that's really gets referrals, it gets people in? And do I have it outside of the clinic where people can get stuff done on their own, but give me the data and it helps bring them in so that they're with me for life? So those 2 things are really important. And I think helping your patient get the junk out of the medicine cabinet, game changer, because every patient, you can have them purchase some products and tell them what to replace. You're not just having them purchase products because of their condition at the moment. And I think that's a big deal. Don't you think, Janine?
That's a huge deal. Absolutely.
Because you can focus in your clinic, docs, and have, okay, staff, this week, we're going to focus on getting all of these NSAIDs out of our patients' medicine cabinets. And you work on that natural NSAID pack. And then in a few weeks, you say, all right, our goal is to get everyone to take probiotics before antibiotics. Let's get everything cleaned out of the medicine cabinet. So your whole staff is on board and every patient can benefit from it. You're not just doing it condition by condition, right? Protocol by protocol. And it makes it fun for your clinic also. And maybe even doing some fun things with them, like, hey, if we get X amount of patients to do this week, we'll bring in lunch or we'll do something fun.
Can I answer Ruth really quick? She's asking, can you only take NSAID for pain or is it something you take daily? I love the NSAID pack for daily use. It is, if you think about what's in there, you have all those phytonutrients, very high doses. You've got the EFAs, you've got the joint support. And so it helps with everything. I mean, everything we think about those phytonutrients, cardiovascular health, blood vessel support, and muscular recovery. I notice when I'm taking them regularly, I don't get as sore. I recover really quickly in the gym. It helps with the sleep. When I take them at night, I get great recovery on my Whoop strap, great deep sleep, joint health, eye health. So yeah, absolutely. You can take it every day.
Yeah. And the thing is, remember, inflammation is one of the main causes of disease, and this lowers the C-reactive protein in the body. You have someone with high systemic inflammation, C-reactive protein high, it lowers it. So they might not have a pain, but they have inflammation, or you can see they have inflammation, right? You don't even need a big test for that. Just pinch them and you can see if they have inflammation, and this really helps to lower it. It's one of those secrets we use with the athletes too, just to lower that inflammation. And so definitely want to do that. So thank you so much. Thanks for the questions, Ruth. Let's close up because we're going to jump over. Becky just put again the new link. This is the link you're going to go to get on the public webinar where we're going to train your patients in the public. That's on that webinar. We're going to switch over right now. Appreciate you guys. Please take advantage of the special. Decide right now in your clinic that you are going to help your patients clean out their medicine cabinet with the junk that's killing them with the natural alternatives, and have some fun with it every week in your clinic. Promote it. Do different things and really have that commitment. That mission will come through to your patients and they'll feel that you really care. Not that they're being sold to, that you care to really get them on the things that's going to benefit them long term. So again, appreciate you guys. Love you. We'll see you in just a minute.